Hello and welcome back to this video lecture. And this video lecture, we are going to discuss or present briefly the different side effects of this identified um, vaccines. Okay, so first in this matrix, we have the BCG vaccine or your Bacilli calmette-guerin vaccine. As we have mentioned, it helps prevent tuberculosis and tuberculosis-related infections, and also, based from other references, leprosy. Okay. Um, BCG is administered intradermally, okay, as we have mentioned, and we all know that intradermal injections should produce wheal, okay, or induration, or mm, a small circle in your skin, and this will later on develop small red tender swelling to ulcer and to scar formation. Okay, side effects not usually notified for BCG are Koch phenomenon, named after Robert Koch, someone related to TB. If you remember your microbiology, and later on we'll discuss it on communicable diseases. So this is an acute inflammatory reaction, and there's no management needed. Okay, so it will heal, it will subside on its own. For other side effects, which is less um, common to happen, we have your deep abscess or at the vaccination site or lymph nodes, and management here is incision and drainage. Going to incise the part and drain the pus out, and this is not a normal side effect. Together with indolent ulcerations with INH powder or isoniazid powder and glandular enlargement, this is also treated as deep abscess. Again, these three, after the Cox phenomenon, are not usual side effects. Okay, going back to the first column, we have the wheal, the swelling, the ulceration, and the scar. So usually this takes time. Okay, swelling usually happens maybe based from one reference is 2 weeks to 3 weeks. Then it forms a to an ulcer that heals by itself, and by 12 week the scar stays in the skin. Okay, so that's the common side effect for, and the less common side effect for BCG. Then you have your DPT, Hep B, HIB, or your pentavalent vaccine. Common side effects are fever, usually a day after vaccination, and management here are antipyretics and TSB. Usually there are no really special treatments or management when it comes to side effects of vaccines. Another one, local soreness, swelling in other references at the injection site, no treatment again. Usually it lasts for 4 days. Abscess, less common. Side effect, unexpected actually. This an abscess appear a week or more, usually due to wrong technique, usually to unsterile techniques. So this is not a common side effect. This is not expected side effect. And incision drainage would be required to do. Then absolute contraindication. It's not mild. It's really a dangerous one. The formation of convulsions after the first dose of the HIB or DPT in the old uh, expanded program on immunization law. Okay, although this is very rare and usually happens 3 months, and this is usually caused by the letter P component, which is pertussis. Okay, proper management should be done, proper reporting to your, let's say, your physician or your pediatrician, whoever immunize your child, should be done. And this occurrence of convulsions usually warrant a discontinued course to discontinue the course of the vaccine. Then we have polio, usually no side effects. AMV or your anti-measles vaccine, the fever and the rashes is usually common 5 to 7 days or a week after the vaccination. Um, you have your antipyretics, then TSB as management, measles, mumps, rubella, or your second type of AMV or measles vaccine. You have local soreness, fever, irritability, malaise, and again antipyretics for the treatment or management. Rotavirus. Some children develop mild vomiting and diarrhea. Okay, and also fever and irritability. Again, no special management. It does not warrant discontinue uh, decisions. Antipyretics and oral rehydration solution for infants who will be experiencing diarrhea and vomiting. Okay, then tetanus toxoid for the pregnant ones. Pain, redness, swelling on the injection site. Usually no management. Okay, for OPV, if the child vomits, give a second one. Okay, if the child vomits again, give a third one. And if ever the child vomits for the third time, maybe you should um, refer. You should refer the child to a physician if the child vomits for the third time. Okay. I also read in one reference if the child has diarrhea, okay, just like what I mentioned, you just continue giving OPV. Okay. At some point, the Philippines um, was declared to be a polio-free country in the 2000, I think in the year 2000. Okay, so I hope we have maintained that, especially last year, I think, or 2 years ago, there were reports that there were cases of polio, but we hope it was controlled really, and we are still on the maintenance of a polio-free Philippines. Okay, here in this matrix, we are I am presenting to you another component, other characteristics of vaccines. Okay, uh, another characteristics of vaccines. Vaccines are substances which are very sensitive at various temperatures, and this is actually related to cold chain logistics management, and to maintain its potency, to avoid its spoilage, uh, vaccines need to be stored at correct temperature. Okay, so what I will be emphasizing here is the last column. Actually, it's the actually all of these are important, but in terms of cold chain logistic management, the temperature is being emphasized. And later on your actual um, encounter with these vaccines, the third column is also important. What's the form or the preparation of these vaccines, so that you will be familiar also on how it looks like. Um, if you can see in your screens, it is some of the statements in column 2 is live attenuated. This means these are live microorganisms that have been genetically modified, and these are live, and these are real, these are live microorganisms, whether it's virus or bacteria. These are modified to maintain its antigenicity, but weak. Um, they are they lose their pathogenicity or pathogen activity. Okay. Um, so first we have PCG. This is a live attenuated bacteria, freeze dried one. This is the powder form, and when exposed to it, it is destroyed. So it should be stored in a temperature of 2 to 8 degrees Celsius. For your pentavalent vaccine, including your Hep B vaccines in separately. Um, oh, sorry. In this case, we have the second row, DPT, Hep B, HIB, or the pentavalent vaccine. It's liquid in nature, and usually, especially during the first use of this, is in a disposable syringe, and it's displayed by heat and freezing, positive 2 to 8 storage temperature. Then OPV, your oral polio vaccine, is a live attenuated virus, liquid form, of course, and easily destroyed by heat but not by freezing. It should be stored in a negative 15 to negative 25 degrees Celsius temperature. Your AMV, or your anti-measles vaccine, live attenuated virus, freeze dried also, just like BCG, powder form, needs to be reconstituted on a solvent. So you need to mix it with solvent to make it soluble and to liberate it into its liquid form. Um, it is easily destroyed by heat but not by freezing. Again, it should be stored in a negative 15 to negative 25 degrees Celsius. Hep B vaccine, the the vaccine that's given after birth also, which started on the old EPI law. Um, it's liquid in nature, damaged by heat or freezing. It is stored in a 2 to 8 degrees Celsius temperature. Then tetanus toxoid is liquid and damaged by heat or freezing 2 to 8 degrees Celsius also. Um, for tetanus toxoid, as you can see, it's not really the bacteria itself, but the the component of the vaccine is the toxin of the bacteria. Okay, compared to your BCG, it's a bacteria. Compared to your OPV and measles vaccines, these are really virus and bacteria. For again, for tetanus toxoid, there's no bacteria, but the toxin of the bacteria is there. Okay. Then additional in the table we have uh, the MMR or measles, mumps, rubella, or your AMV2 based from other references. This is a live attenuated virus, also in powder form. It's destroyed by heat and also by freezing 2 to 8 degrees Celsius. Same with rotavirus, only that is liquid in nature or in form. Going back to the previous slide, as you can see, there are only two temperature ranges to keep in mind: positive 2 to positive 8 degrees Celsius and negative 15 to negative 25 degrees Celsius. As you can see also, that the most sensitive vaccine in terms of temperature is oral polio vaccine and anti-measles vaccine. Okay. But here, between the two, the most sensitive to temperature changes to heat is oral polio vaccine, and the least sensitive is BCG and tetanus toxoid. Okay, so additional information, important considerations on these vaccines. Okay, use only one sterile syringe per client. Okay, that's given because we are this is personally used because these are invasive procedures, so safety is very important and of priority. No need to restart a series of vaccination regardless of time or doses that have been missed in between. I repeat, no restart of vaccines. It only you can continue it with the second dose or third dose. The what's the consequence? The effectivity rate is lower. Okay, all the EPI antigens are safe and effective when administered simultaneously. That is during the same immunization schedule, but at different sites. Okay, we are not really saying all vaccines in one time. Okay, scheduled vaccines at the same time. Okay. OPV followed by rotavirus vaccine and then other appropriate vaccines. You start with OPV first, okay, then rotavirus vaccine and other injectables. For number three, also, however, it's not recommended to mix the vaccines in a single syringe. Okay, just remember that one vaccine, one syringe, one patient, one syringe. Moreover, if the site is of the same limb, the site should be at least maybe an inch apart, 2.5 to 5 centimeters apart. Okay, but the farther the better. Okay, so again, um, if you're going to use the same limb, for example, same right thigh is to be used, give some allowance. Okay, then on the fourth one, OPV followed by, okay, here OPV is usually administered with a dropper. Uh, it can be with the manufacturer's preparation, and the dropper should not touch the child's tongue actually. Okay, for proper absorption of the vaccine. Okay, other considerations, only monovalent hepatitis B vaccine must be used for birth dose. As you can see in the table that I've presented, there is the pentavalent vaccine with Hepa B vaccine, and there's a column there that separates the Hepa B vaccine. So those are two different vaccines, and the separate um, Hepa B vaccine, this is what monovalent is referring to. Okay, which are only used for birth dose. Pentavalent vaccine must not be used because DPT and Hib vaccine should not be administered at birth. Okay, so later on when you study, you should remember the minimum age requirement for those vaccines and what are the gap between the doses of vaccines. Okay, in case the children who did not receive AMV1, or if the parent caregiver forgets if the child received such, AMV1 shall be given as soon as possible, followed by AMV2 1 month after. Okay, AMV1 refers to your anti-measles vaccine. AMV2 refers to your measles, mumps, rubella vaccine. Okay, as we already have been mentioning, AMV1 or measles vaccine, anti-measles vaccine should be given um, uh, should not exceed 9 months of age for higher effectivity rate. Okay. All children entering daycare centers or preschool and grade 1 shall be screened for measles immunization. The first dose of rotavirus vaccine is administered only to infants aged 6 weeks to 15 weeks. Second dose is given 10 to infants aged 10 weeks to a maximum of 32 weeks. Okay? So children without vaccines should be referred to nearest facility. Okay? So uh, the next topic on our next video lecture will deal on cold chain logistics management, and I think the end of this video lecture for expanded program on immunization. Thank you.